Hello everyone, here we'll learn how insulin secretion is regulated. Whenever there is increase in the glucose levels, glucose enters into the beta cells through the GLUT2 receptors and the glucose is phosphorylated to the pyruvate. Pyruvate enters into the citric acid cycle where it is going to generate ATPs, and ATPs they are going to suppress ATP dependent potassium channels. That is, it reduces the efflux of potassium accumulates, which causes the depolarization of the beta cell. That causes activation of the voltage gated calcium channels. Calcium enters inside and calcium causes the degranulation of the calcium insulin vesicles, and which is sensitized by the glutamates which are produced from the pyruvates. And the insulin secretion is affected by the various factors, like it can be at substrate level, it can be because of the increased cyclic AMP levels. Autonomic nervous system affects the GI hormones and potassium depletion, and oral hypoglycemic drugs may play important role. Substrates like glucose, proteins, especially arginine, lysines with beta keto acids, they play very important role in insulin secretion, where accumulation of the cyclic AMP, which is caused by beta agonist, and phosphodiesterase inhibitors like theophylline increases insulin. The autonomic nervous system, sympathetic and parasympathetic, where sympathetic decreases the insulin, whereas parasympathetic increases. Sympathetic, if it is mediated through the beta agonist, it increases the insulin secretion, whereas if it is mediated by the alpha-2, it is going to decrease. Whereas parasympathetic, through the M4 receptors, by accumulating the calcium, it is going to increase insulin secretion. Growth, GI hormones, especially the gastrin, CCK, secretin, GIP, especially GLP-1, that is glucagon-like peptides, they increase the calcium channel activity and increase the insulin secretion, where they're going to play important role in the insulin secretion when it is when the glucose is ingested by the oral route. Hormones like glucagon, growth hormone, cortisol, they increases, whereas somatostatin decreases, where potassium depletion causes the decrease in the insulin secretion. Oral hypoglycemic like sulfonylureas, they depress the potassium channel activity, whereas bigonides, they decrease the gluconeogenesis.